I want to talk today about numbness and tingling in the arms and hands. One of the very common questions I get is, why am I having numbness and tingling in my arms and hands? Everyone's first go-to is that they might have carpal tunnel syndrome. And that's likely in some cases, but it's probably 50-50 that it's coming from someplace else. And so when you come to the clinic, when a person comes in and says, hey, I'm having numbness and tingling in my hands, the first thing I begin to ask myself is it coming from the neck area or is it coming from further down the extremity? I always like to use the analogy of a water hose. And so if you've got a kink in a water hose, it cuts the flow of the water down, and you can have multiple kinks in the water hose. Well, you can have the same in the nerves in your body. You can have a pressure here or in your elbow or in your wrist, or just common areas that they occur. Sometimes you can have several at the same time. And so I've got Megan here as a model to show you kind of what I would do and what I would look for. So the first thing I might ask her would be, hey, are you having neck pain as well? And she would say yes or no. If she's having some neck pain and she's having numbness and tingling in her arm, then I would begin to ask, where is your numbness and tingling? What fingers is it going to? Is it all the way down your arm? If the numbness and tingling is simply in the hand and it's in these three fingers are commonly carpal tunnel syndrome, okay? So that's coming out of the wrist right here, the middle of the wrist. There's a nerve called the median nerve that gets pinched right here. But if the numbness and tingling is all the way down the arm and covering the whole hand, then I'm going to head up toward the neck and try to figure out if it's coming out of the neck. There's a couple of places in the neck it can come from. You've got discs in your neck between each vertebra, and behind those is a nerve that comes out, and that bundle of nerves goes all the way down the arm. If a person's having pain down the shoulder blade and the arm, it's likely that they're having a pinched nerve in their neck. Relax. Another thing that can happen is you can have muscles that are too tight in the front of your neck and in the front of your shoulder. If these muscles in your neck get too tight, as the nerves cross through the muscles are actually pinching the nerve too. We call that thoracic outlet syndrome. If you're having numbness and tingling in these two outer fingers right here, if she came in and said, I'm having numbness and tingling here, I would check the elbow and see if the elbow is having an impingement here. This is your ulnar nerve, and this is called cubital tunnel syndrome. And so you can get cubital tunnel syndrome that's causing numbness and tingling here. Any of these patterns, though, can also be coming out of the neck. And so we check all three areas, sometimes four areas, to see where that pinched nerve is coming from. And then we focus our treatment on the area of most pinch or most pressure. And we work all the areas to get the pressure off the nerve and get relief for the patient.